the Atlanta Clinic of Preventive Medicine, and today I want to talk to you about the warning of silver mercury amalgam fillings that are used by dentists in the United States and pretty much worldwide. Have you ever stopped to consider what those silver fillings are in your mouths? Do you know that they're 52% mercury and other toxic metals like tin? Do you know that studies have shown that they may spread through the body and end up in the bones, the kidney, and the liver, wreaking havoc with our immune systems? Why is it that 3 European countries have banned the use of these silver mercury fillings? Why is it that in 1 European country you cannot even be eligible for health insurance until all your mercury fillings have been removed? Why is it that the Environmental Dental Association and other concerned organizations have called for a ban of silver mercury fillings? Why is it that world-renowned scientists, environmentalists, and even dentists consider these mercury fillings to be time-release mercury poisoning? Furthermore, why is it that world-renowned toxicologists and specialists in mercury toxicity have declared silver mercury fillings unsuitable for dental material? Let's look at the facts. Mercury fillings have been used for dental fillings for about 100 years and were actually introduced in the country because they're so cheap compared to gold fillings. They're actually 52% mercury, and silver, nickel, and tin, other potentially toxic constituents, are added. They discovered that they could replace the expensive gold fillings, and they're cheaper and durable as well. So believe it or not, 85% of the industrial world has mercury fillings in their mouth. In the United States alone, over 1 million of these toxic fillings are placed in the mouths of its citizens every single day. And this is the same mercury used in thermometers, the same mercury that kills fish, and it's the same mercury that's more toxic to our bodies than lead or arsenic. Research shows that mercury slowly escapes from dental fillings when we brush, chew, or grind our teeth. And this ends up in vital body organs. And that's been proven by scientific analysis. Mercury is so toxic that at certain levels, even the tiniest amounts are regarded as unsafe. Once removed from our mouths, the government requires strict handling of this material, the mercury, so that it doesn't, quote-unquote, pollute the environment. In other words, it's illegal for mercury to be put in the wastebasket, to be put in the toilet. Why? Because it has to be disposed of safely. But guess what? It's in our mouth. There's no known safe level approved for mercury exposure as well. The government has not deemed this dangerous to our health, and that's because no one's proven to them that mercury put in the mouth causes health problems. But there's no long-term studies that have been done. But there are long-term side effects, and animal studies have proven that the mercury does spread throughout the body from the fillings. And there's been documentation of this in many, many studies. So what we're talking about is leakage of the amalgam through mercury vapor into our bloodstream and our bodies. There are certain diseases that have been potentially associated with the mercury in our fillings. And Dr. Hal Huggins is a prominent dentist and a pioneering scientist who has led the way in this research on dental mercury fillings and disease. First of all, multiple sclerosis has, in some epidemiological evidence, been associated with mercury, and Dr. Hal Huggins even has noted improvements in mercury latent patients who have multiple sclerosis and improvement. Parkinson's and Lou Gehrig's diseases are neurological manifestations of breakdown of the immunological system and a degeneration of the nervous tissues. Some have linked this to mercury toxicity as well as cavitation, which is a hole in the head syndrome created when teeth are pulled out incorrectly. Then Alzheimer's disease is another potentially mercury and amalgam associated with disease, and arthritis as well, lupus erythematosus, which is an autoimmune disease. So right now in our clinic we are using mercury detoxification to deal with Alzheimer's as well as regular chelation therapy and diet and everything else that we do. We've had some notable success as well. Basically, there's 5 disease categories that are linked to mercury amalgam fillings. One is neurological, that's Alzheimer's, multiple sclerosis, emotional disturbances, depression, anxiety, all that sort of thing. Then there's immunological problems like scleroderma, lupus, rheumatoid arthritis. Then there's osteoarthritis, which is wear and tear arthritis. And see, what happens is the mercury can set up free radical damage and damage the joints of our bodies. Then there's miscellaneous symptoms such as chronic fatigue, brain fog is a big one, and chronic fatigue as well. Digestive problems, inflammatory bowel problems, irritable bowel problems, Crohn's disease, and colitis. And cardiovascular diseases such as heart pain, high and low blood pressure, tachycardia, irregular heartbeats. So the problem is that these symptoms can be caused by other problems, but mercury has been linked to them in many, many scientists' mind. And we're talking about PhDs, dentists, and medical doctors as well. Now, there's other symptoms that appear to have strong possible association with amalgam fillings, such as allergies, irritability, circulation problems, insomnia, memory loss, constipation, leg cramps, ringing and noise in the ear, itchings, rashes, nervousness, headaches, diarrhea, gum problems, dizziness, thyroid problems, vision problems, ulcers, etc. So I think we're dealing with the new science here, the science of mercury detoxification. Again, there's no safe levels of mercury. You're not allowed to put it into the environment once you take it out of your mouth, which tells you something right there, folks. Mercury is not safe. It's very toxic, and I would, as well as at a German amalgam conference, Dr. Lars Friedberg recommended completely avoiding it as much as possible, and I agree. He unequivocally said that the dental associations of the Western world are flat out wrong in telling people that mercury amalgams are completely safe. They're not, folks. You need mercury detoxification, and just taking them out is not enough. What you have to do is to detox the whole body through the method of chelation therapy with DMPS, or 2,4-dimercaptylpropionyl sulfonic acid. This is an injectable synthetic amino acid that goes into the body and pulls the mercury out the body. You can get this injected into the muscle right before or right after you get the amalgams removed from your mouth, or, and very importantly, you can get it intravenously in a slow drip to pull the mercury out of the rest of the body. And that you get done when you are through getting all the mercury fillings removed. I think it's very important to note that many people have had the mercury fillings removed and have not gotten well until they get the DMPS chelation therapy. Studies reveal that a 10-year-old mercury filling can leak up to 40% or more of its mercury content. So where'd the mercury go? Well, scientists took sheep and put radioactive mercury fillings in its teeth that would show up black on an x-ray. And this work showed that the mercury fillings eroded and ended up in the sheep's liver, kidneys, colon, and in tissues all over the body. Therefore, their research shattered the comfortable illusion that mercury amalgam fillings are stable and safe. Then so-called authorities claimed that sheep chew too much. So the same experiment was performed on monkeys, revealing the same stunning results, that mercury contamination goes throughout all parts of the monkey's body from the amalgam fillings that were placed in the monkey. Other studies show that 2/3 or more mercury found in the body came from tooth fillings, and that it's unwise to use mercury amalgams as dental fillings because no research has shown them to be safe. It is not worth the health risk when there are other non-toxic materials to fill teeth that are safer and just as effective. I myself have had my amalgams removed years ago. My brother has had his amalgams removed years ago with very good results. The last amalgam removed from my mouth left my mouth feeling lighter, less metallic taste, and I haven't been the same since in a very positive sense. Other studies have showed that leakage from the mercury amalgam fillings traveled to the brain. And that's done by Dr. David Eggleston, who happens to be Tom Cruise's dentist. And he did cadaver studies and proved that. And therefore, Dr. Eggleston will not use mercury fillings in his practice and has had all his fillings and family members' fillings removed as well. Another research project showed that even the tiniest quantities of mercury metal in the brain can produce changes in the brain that are identical to the debilitating and deadly Alzheimer's disease. And that's why we emphasize the detoxification with the DMPS, either intramuscularly or IV after all the mercury is removed. Mercury toxicity, as well as other toxicity, can show a loss in function of the central nervous system. And it can even result in decreased manual dexterity and concentration. This has happened to dentist after dentist. I even have dentists in my practice who have had mercury toxicity and have had to retire early because of this toxicity. And of course, there's increased vulnerability in children and the unborn, so do not, folks, have women have your mercury removed or worked on when you're pregnant or breastfeeding. You cannot do that. But after examining the brains of dead babies, mercury deposits had crossed the placental barrier into their tiny skulls. So many dentists are now restricting their practice away from mercury amalgam fillings. Just about every pediatric dentist uses no mercury fillings whatsoever. And many enlightened adult dentists also use no mercury fillings and will gladly help you detox your body of the mercury, as we will in conjunction with the dentist by using the DMPS Chelation Therapy. The way this works in the mercury detox treatment, we can give DMPS when you have amalgams intramuscularly to help curtail the movement of mercury from the drilling of the amalgams into the body. So the DMPS will literally catch the mercury and send it out through the urine and the feces. Now, if you have some debilitating diseases along with this, like chronic fatigue, we suggest anywhere from 2 to 6 IV vitamin and mineral infusions, including antioxidants, vitamin B complexes, and vitamin C prior to the procedure to build you up. And without amalgam fillings, let's say you've had all the fillings removed, at that point you do anywhere from 2 to 6 IV vitamin C mineral infusions prior to DMPS, especially if you have a debilitating disease, and then do DMPS, usually IV, once a week or more, depending on what type of results we need and how soon. We usually give it IV, and that way it thoroughly gets into the body to pull the mercury out. And we've shown in our own internal studies that the mercury decreases steadily with the infusions, and we've had great success in people ridding their body of mercury forever, and we will be glad to help you with this as well.